Let's talk about what you can do, along with your doctor, to keep track of your PBC and understand what it means to you. First of all, it's important to be familiar with the 3 key factors that your doctor will be looking at in monitoring the progression of the disease. These factors are your blood work, your liver scarring or fibrosis, and your symptoms. It's important to establish a baseline for each of these factors so you can understand what's happening with your disease in the years to come. Over time, any one of these 3 areas may get worse or improve, but there isn't necessarily a direct link between them. For example, your symptoms may get worse, but your blood work and the amount of fibrosis may stay the same. Or, you might have increased fibrosis, but your symptoms are improving, and your blood work hasn't changed. The point is, these 3 factors, blood work, liver scarring, and symptoms, are equally important, and you should be ready to talk with your doctor about all of them, because that will be the basis for discussing your treatment plan and prognosis. Your doctor will decide how often you need to be monitored, but you both play an important role in assessing the progress of your PBC. Your doctor will do regular blood work looking at all markers for your liver and its function, especially looking at your ALP levels as well as bilirubin and GGT, which stands for gamma-glutamyl transferase. During your regular visit, it's common to use FibroScan technology to assess fibrosis in the liver. It's a quick and simple test. If you don't have access to FibroScan, your doctor may use an ultrasound or CT scan instead. Sometimes, but not always, a biopsy is necessary, but you might never need one. Your blood work results are your most important tool. Whether your blood work is checked monthly or annually, it's good for you to understand what the tests are measuring, as well as the results. A good way to start is by keeping a log or copy of your test results and watch for any significant changes over time. Also, keep a diary of your symptoms so you and your doctor can keep track of all the changes that might be taking place. Because you have a chronic disease, you and your doctor have entered into a long-term relationship. Like any good relationship, it's important to have open and candid communication. Prepare some notes and questions ahead of your appointment. Write down any information you want to tell your doctor about your symptoms and be ready to discuss how you may be reacting to your medication. Ask for a copy of your blood work and imaging results, and make sure you get a clear explanation of what those results mean. Sometimes it also helps to take a friend or family member along to your appointment to take notes and be a second set of ears to listen to what your doctor is saying. You may also want to initiate an open and frank conversation with your doctor to make sure you have all the facts you need to manage your disease. For example, your doctor should be able to tell you the stage of your fibrosis, discuss your prognosis, and answer all questions, such as, will I need a liver transplant? Living with PBC is a lifelong journey. Sometimes symptoms change. They may worsen, improve, or even disappear. As you experience normal aging, it can be hard to tell if what you're experiencing is a result of PBC or simply the natural changes that go along with getting older. No matter what the reason, we in the PBC community have learned many lessons along the way that can help you live well with your PBC. We're happy to have the chance to share them with you in part 3 of this video series, Living Well with PBC.